Hello, my friends, and welcome to the Pathway channel. Today, we will discuss the papillary renal cell carcinoma, which is the second most common renal cancers. And just to be oriented, I'm on a low power now on 2.5, and this is the perinephric fat, and this is the capsule around the tumor, and this is the beginning of the tumor. So let's go ahead and take a look on this mass. As you can see from this power from the 2.5x, you can appreciate here that this pattern is a papillary pattern where you find a papillae. And at this power, we cannot see whether we have a fibrovascular core or not, but we will go on higher magnification to see this one. Let's go take a peek around on this power first. And as you can see, the pattern may change. So sometimes this is papillary, sometimes it's tubular, as you can see in this area. These are just some tubules and they range from small to mid-size tubules. Sometimes it's a solid pattern, sometimes glomeruloid, but mostly it's a papillary pattern. So let's take a look again at this power. This is fibrous tissue septa that separates the tumor mass. And of course, it may have some blood vessels into it. So this is part of the tumor, like a necrotic area, or this is a necrotic area of the tumor, which we may see. And again, fibrous tissue septa. This is some pigmentation here, as we can see, and this may be common in renal cell carcinomas. You can see some hemosiderin in the tumor cells. So I will just go to the first place where we started, and we will go on a higher power to appreciate the features. Now we are on the 10x, and here we can see again the papillary projections coming out, and here we can start to appreciate the fibrovascular core that is lined by these tumor cells. So these are fibrovascular cores and they are lined by the tumor cells. Let's go on a higher magnification. So yeah, this is more clear on this magnification. You can see the cores and you can see the malignant cells surrounding it. And I hope you can appreciate also the nuclear features. So the cytoplasm is a bit of eosinophilic, and you have these nuclei with the prominent nucleolus inside in each of these cells. We might go at a higher power also to appreciate more features about the nucleus. So let's go. Now we are at 40x. And at this power, you can see that we have some clear cells and some other cells with this eosinophilic cytoplasm, which is common to happen. And we have some pleomorphism of the nuclei. And also we have these prominent nucleolus, which is found inside each of the nuclei. And in this case, we gave it grade 3, IUSP grading. It is grade 3. I will go just on a low power again to get a good area where we have a fibrovascular core. We can discuss a bit about the content of this fibrovascular cores. So in clear cases, and if you see a foamy macrophage in the fibrovascular core, this will help you and aid the diagnosis of papillary renal cell carcinoma, and I hope you can appreciate it here. So here we have this fibrovascular core, and it contains these foamy cells. These are foamy macrophages, which are present in papillary renal cell carcinoma. I hope also at this power you can appreciate the inflammation that is going as a secondary diagnosis. These are acute inflammatory cells. They are neutrophils, and they are going all over the slide. And here also, we can see these foamy macrophages in the fibrovascular core, and this will aid in the diagnosis of papillary renal cell carcinoma. And in this case, actually, we didn't need any of the stains, and it was a clear diagnosis of the papillary renal cell carcinoma. Here we can find also the fibrovascular core, and it's lined by these malignant cells. We can go last time on a higher magnification here to see these cells again, and to see the fibrovascular core, and to see the inflammatory infiltrates, that acute ones that are present all over the place. And these are again another place where we can see the pleomorphism of the nucleus. It has a clear membrane, but it has also these nuclei which are present inside. Thank you so much for joining this session. Please like and subscribe to the channel to follow other videos.